I am Dr. Waseem Sajjad, and today we will discuss about brain stroke, the different types of brain stroke, and how radiological imaging helps us in diagnosing the stages of the brain stroke, and how the features of radiological imaging affect the management of the stroke patients. Again, CT scan and MRI are the most important radiological imaging modalities to diagnose stroke. First of all, we learn what is stroke. Brain stroke is any kind of persistent neurological deficit. This deficit can be due to ischemia, due to hemorrhage, or due to any other cause. So, if we divide the stroke into different types, there are ischemic stroke, there is hemorrhagic stroke, and there is transient cerebral ischemia. So, what is ischemic stroke? Ischemic stroke means there is ischemia of the brain parenchyma. Ischemia of the brain parenchyma means that the oxygen supply to the brain parenchyma is not adequate, and cells of the brain parenchyma are start necrosing. As a result of this necrosis, there is neurological deficit, and we called it stroke. So, this ischemia can be due to many reasons. The most important reason is that there is any thrombus or emboli in the vessels which are supplying blood to the brain. When there is thrombus in the vessels which are supplying blood to the blood supply to the brain is compromised. When the blood supply of the brain is compromised, that part of the brain cannot maintain aerobic respiration, and necrosis starts, and we called it as stroke. Similarly, hemorrhagic stroke means that there is hemorrhage inside the brain, and due to this hemorrhage, that particular area of the brain cannot sustain aerobic respiration, and due to this there is necrosis and death of the brain cells, and due to this there is neurological deficit, and we label it as stroke. Now there is a third entity which is called transient cerebral ischemia. Transient cerebral ischemia means that the changes which appear due to ischemia are reversed within 24 hours. If the changes of ischemia are reversed within 24 hours, we label it as transient cerebral ischemia.